Hi, my name is Salma Jenis, and today I'm going to be talking about patellar tendinitis, also known as jumper's knee. In order to evaluate my case, I'm going to be using a SOAP note, so I'm going to be going through subjective, objective, assessment, and plan. The subjective is where the patient reports their feelings on the condition. It's not always perfect, but it can be very valuable. And objective, which is measurable observations which are reliable due to testing. Assessment, the analysis and conclusion of the subjective and objective portion. This is where the issue is presented. And plan, which is where we address the goals of the treatment and what methods we will be using to achieve those goals. The treatment will follow a patient who is 19 years old, a college student named Adrienne Thomas. She is new to the game, but has recently joined an intramural handball team. She has been playing a handful of games per week for the last 3 weeks. She is complaining of pain in her left knee, which keeps her from playing for long periods of time. In this case, we have the patellar tendon functioning as a ligament, as it joins the patella and the tibia right here. The patellar tendon can become irritated from repetitive injury, so this right here becomes inflamed, and the inflammation can cause pain. The general term for micro tears and inflammation of the patellar tendon is tendinopathy. People more susceptible to this injury are people who receive repetitive trauma from either kicking, jumping, or running. They lack alignment in the knees, the hips, or the ankles. Overpronation will also cause a poor arch support, and that is also a detail that could aid in the cause of patellar tendinitis. Under the subjective portion of my note, I have the patient being a young adult female complaining of pain in her left knee. Recently became a handball player. During the game, she states that her left knee hurts more when she is running, especially when she jumps and lands. Pain is intense when she bends at the knee. After her game, she has noticed her left knee become red and swollen. Her knee is tender to touch. Patient appears to have a valgus stance. Under the objective portion of the note, the patient was tender to palpation at the patella and tibia. Pain is rated 3 out of 5, and the patient presented mild swelling at her left knee. As for her range of motion, active and passive are within functional limits for extension and flexion, however not within normal limits. Muscle testing showed that she is weaker in her left quad than her right, and that she has weaker arches. Gait analysis showed that slight pronation and valgus stance is present. Assessment. The diagnosis for this case would most likely be the patellar tendinopathy. The patient is most likely experiencing patellar tendinitis from the repeated impact to the tendon during her handball game. The inflammation is causing pain to the patient in activity where there is flexion or extension, a common sign in patellar tendinitis. She also has a lot of variables that would leave her prone to patellar tendinitis, such as weak left quad, weak arches, and valgus stance. My goals with seeing this patient would be to relieve pain and prevent future injury. We would relieve pain through rest, ice, and elevation. Prevention would also aid in some relief to pain. We would have stretching and strengthening exercises. To further explain rest, I wouldn't suggest her to stop all activity that she's doing now, as exercise is an important part of rehabilitation. However, the intensity and quantity of times that she plays handball should probably be reanalyzed. Ice, so to reduce swelling of the tendon, and elevation to also reduce swelling of the tendon. In the prevention part, we will be doing an exercise protocol so that she comes in twice a week for the next 3 weeks, but so that she also does these exercises at home 3 times a day. We have the stretch and strengthening portion. The stretch would probably become before the strengthening portion, For each of the stretches, I have 20-second holds, 5 each leg. That's important. I want her to do these stretching and strengthening exercises on both legs. And for the strengthening, I have 5-second holds, 15 reps, 3 sets, and I want her doing these 3 times a day. This one has a 1-second hold, just so that it's clear, but when we further explain these. In this section, I'm just going to be going over the stretch, what these actual stretches would look like, not the prescription for like reps, sets, holds, just what they would actually look like. In this IT band and glute stretch, you have the person sitting on the floor with one leg extended while the other leg crosses over, and the torso is going in the turning in the opposite direction from where the leg is facing. With this, either your arm support, you can push on and hold that stretch that would be felt here for 20 seconds and switch legs, same thing, leg over the other, and that's another 20-second hold, and that would be one completed set. The standing hamstring stretch, you have the person upright with their leg propped on a bench or something to elevate the foot, and this leg extends, the knees like fully extended, and there's a bend at the hip where the torso bends, and there's like a slight tap on the foot, and that's a 20-second hold. Switch foot, and that's a 20-second hold. For the quadricep stretch, you can support yourself on the wall or some other form of support. You have the same side arm reaching for the foot on the leg that's going to be stretched, and you pull it behind you and you get a stretch on the quad. You hold for 20 seconds here and then switch, and you hold for 20 seconds, and that is one set. In the strengthening portion, again, I'm not going to be going over as much on the prescription reps, sets, and holds. I may brush over them. So the isometric quad exercise is where the person is laying down and you put a towel, something to prop up underneath the knee underneath the knee on the leg that's being worked, and you extend the knee up so that it's not like this at rest, and you hold for 5 seconds, rest, that's 1, extend, down, rest, 2, same thing on the other leg. You also have straight leg raises, which instead of having a towel, you are propped up here so that the leg is already flat on the floor, and you lift through extension the leg. That's 1 down, 2 down, 3 down, and you can switch to the next leg. Hamstring curls are going to be done upright, and you can grab onto something to support yourself. You bend at the knee, starting from the ground. The foot comes up from this bend here. That would be 1, 2, 3, and as many reps as was prescribed, and then you can switch legs. Outer thigh leg raises, you have the person laying on their side, and while this leg is a little bent, the leg that's being worked is going to be tapping off from the floor up. That'd be 1, 2, 3. Same thing for the other leg. And in this one, still on your side, inner thigh leg raises is where the leg on the ground is the one that's coming off. So it's 1, 2, 3. Notice that this leg is crossed over the leg that's working to support and balance. Seated abduction is to strengthen the abductors. So you could either have a band here or a ball, depending on what you have, but the person is sitting down and you abduct and hold for 5 seconds, come back, 5 seconds, come back. And this one is the one that I was talking about being 1 second. So it comes up 1 and then slowly bring it down. There's no slamming back down. It's it's a nice, gentle back into placement. Each of them is held for 5 seconds when they're being worked. So when it comes up here, 5 seconds. When it comes up off of here, it's 5 seconds, 5 seconds, 5 seconds. This is the only one with 1 second. The pulling away also held for 5 seconds and comes back slowly. Nothing wants to be done too brisk or bluntly, because then you're not actually working those muscles. The point of strengthening these muscles is to prevent the tendon from being overstretched and it being not having the support that it needs for activities where there is jumping, where there is running, where there is kicking. For the stretching as well, the purpose of that is to not put so much tension on the tendon and have flexible muscles so that when there is this activity, it's not just the tendon that's stretching. Here I listed the sources that I used for the exercises and for the information that you would find on patellar tendinitis. I hope this was a useful tool for treating patellar tendinitis, and thank you for your time.